Acute myeloid leukemia (AML) in children is a rare but serious type of cancer that affects the bone marrow and blood. While AML is more common in adults, it accounts for about 15 to 20% of childhood leukemia cases. AML in children differs from AML in adults in several aspects, including its presentation, treatment approach, and prognosis. Here are some key points about acute myeloid leukemia in children. Incidence: AML is relatively rare in children compared to acute lymphoblastic leukemia, which is the most common type of leukemia in children. However, AML is more commonly diagnosed in infants and toddlers than in older children. Symptoms: the symptoms of AML in children are similar to those in adults and may include fatigue, weakness, pale skin, shortness of breath, fever, easy bruising or bleeding, frequent infections, bone or joint pain, swollen lymph nodes, and abdominal discomfort or swelling. Children with AML may also experience symptoms such as weight loss, loss of appetite, irritability, and difficulty concentrating. Diagnosis: diagnosis of AML in children requires a thorough evaluation, including blood tests, bone marrow aspiration and biopsy, imaging studies such as X-rays or CT scans, and other tests to determine the extent of the disease and its specific characteristics. AML is classified based on the type of myeloid cells affected and other factors, which helps guide treatment decisions. Treatment for AML in children typically involves a combination of chemotherapy drugs administered in phases, as well as targeted therapy, radiation therapy, stem cell transplantation, or immunotherapy, depending on individual factors and disease characteristics. Treatment may be given in phases, including induction therapy to achieve remission, consolidation therapy to destroy any remaining cancer cells, and maintenance therapy to prevent relapse. Prognosis: the prognosis for children with AML has improved significantly in recent years, particularly with the use of more intensive chemotherapy regimens and targeted therapies. Overall, outcomes for children with AML tend to be better than for adults, with cure rates exceeding 60 to 70% in some studies. However, prognosis can vary depending on factors such as age, overall health, subtype of AML, genetic abnormalities, and response to treatment. Supportive care: children with AML require comprehensive supportive care throughout their treatment to manage side effects such as nausea, vomiting, hair loss, fatigue, increased risk of infections, and other complications. This may include supportive medications, blood transfusions, antibiotics, growth factors, and other interventions to help maintain quality of life and optimize treatment outcomes. Overall, the management of AML in children requires a multidisciplinary approach involving pediatric oncologists, hematologists, nurses, social workers, and other healthcare professionals to address the unique needs of children and their families and achieve the best possible outcomes. Early diagnosis and prompt initiation of treatment are crucial for improving outcomes and increasing the chances of a successful recovery.